Let's discuss immunity passports. Now, this is a concept that many are touting as a way to re-energize and reopen the economy. The concept is that people who test positive for COVID-19 antibodies will be given an immunity passport, and this will permit them to go back to work earlier. Now, there are a couple of medical concerns with this idea. First, as I've explained before, we don't know everything there is to know about these COVID-19 antibodies. Do they confer full or partial immunity? We don't know. So that means if you have these antibodies, the next time you're exposed to the virus, will you be completely symptom-free, or will you only have mild symptoms? We don't know. And also, we don't know how long this potential immunity may last. Weeks, months, years, decades, we don't know. Another medical concern is that these antibody tests are not always accurate. So basing an entire policy on a test that isn't always correct is worrisome, to say the least. Now, apart from these concerns, the ACLU also has their own issues with this test, or with this concept. The first being that it divides workers into two categories, or two classes: those that have the passport and those who don't. Now, those who do not have the passport may be discriminated against and may never actually be employed. Now, this may lead some people who are in financial dire straits, as a lot of people are right now, to purposely expose themselves to the virus in order to get COVID-19 antibodies. So now we're looking at a situation where people are purposely risking their lives. The problem is we don't know exactly how this virus is going to affect each individual body. Yes, we know that the elderly and those with underlying health conditions are more likely to have more severe COVID-19 symptoms. But we're also seeing seemingly young, healthy adults have severe symptoms, be hospitalized, and even die due to this virus. Now, a second problem with this idea of immunity passports is that they will most likely be required by jobs that do not permit working remotely. That is your frontline and your essential jobs. Now, these are industries that typically hire migrants, people of color, women. They're frequently low-wage paying jobs that do not allow for paid vacation. So now we are disproportionately affecting this already vulnerable community. Another concern that we have is that we already know that members of the Black, Latinx, and Indigenous communities have decreased access to healthcare, decreased access to testing, and decreased access to treatment. Now, this has all accumulated and led to an increase in underlying health conditions. And we know that these underlying health conditions can put people more at risk to more severe COVID-19 symptoms and even death. And so now these very same communities that are already adversely hit by this COVID-19 pandemic, these members are going to put themselves at further risk by exposing themselves to the virus in order to contract antibodies, bringing even more illness and death into our communities. A final concern, one of many that the ACLU has listed with this immunity passport concept, is that it gives employers the opportunity to simply hire those with the immunity passports, as opposed to investing in the resources that could make the work area safe for all employees and all workers. So I urge you to go to the ACLU website, look at their ideas concerning this immunity passport, and come up with your own conclusions. Thank you for listening.